It's never too late, but the earlier you start, instead of postponing, the better to reverse diabetes.
Dr. Ergin, if somebody were to come up to you, a patient, and say they've been living a very conventional lifestyle, conventional diet, they're overweight, they have type 2 diabetes, and let's even say that they're getting conventional treatment for that at this point, but they say they're ready to make changes and start to live a more alternative lifestyle, eat an alternative diet, and start to get to the root of this diabetes thing. What do you say to that person?
So I don't like to prescribe diets because, as you can know, as you can imagine, and that's statistically also true, half of the prescriptions are not filled. So I first of all I asked them, hey, what do you feel like you can do? Right? Most people are aware of the changes they need to make. I need to understand their social uh, circle and understand their socioeconomic status, what they can do, what they cannot do. I cannot just tell them something expecting that they'll just listen to you, you know. But what I try to get to is, okay, what is your current situation? What makes you lead your current lifestyle? So what are the barriers to a healthy lifestyle? So I'm not necessarily a preacher when it comes to diet. I just like to direct them to the right way. So for example, I'm like, okay, well, what makes you eat fast food, right? Is it because you're too busy or whatever? Then I bring up ideas. Hey, have you looked into Mediterranean diet? Have you tried ketogenic diet? And I want to get a sense of that. And if they say, for example, hell no, I cannot do ketogenic diet. That's impossible for me. Don't even get there. Then there is no point of pushing that because there's already a barrier with the patient. So it is an art dealing with patients. It requires a lot of communication skills. So I try to test their knowledge and understand what's going on. But then for me, if they ask me my opinion and say, what do you think I should do? And I'll go ahead and do it no matter what. I am 100% dedicated and ready. Then I will tell them a low carb Mediterranean diet is the best and most proven method that can be, maintainable in the long term.
And you mentioned the fact that it's an art. And one thing that jumps out at me as you say that is the fact that if somebody is on medications, and again, we use that example, our hypothetical example of somebody that's been living, a classic lifestyle and they're being treated conventionally, I can imagine you as an endocrinologist needs to be very aware of those medications, dosages, and as they're making these big changes, with the hope that depending on the situation that they can come off the drugs, it's got to be a bit of a dance as they start losing weight and balancing blood sugars, how to modulate the treatment.
The most important two treatment class that we have to be very careful about is number one, sulfonylurea class, which is your glipizide, glyburide, glimepiride, which most people are on because they are the cheapest generic, the dirty drugs. I call them dirty drugs because they lower your blood sugar but with an expense to your health. And then insulins, right? If they're on insulins, you cannot just ask someone to drastically change their lifestyle. And if you do, you need to guide them how to do it. If they're on insulin, for example, I'll give you an example. If they're on a basal insulin once a day, I tell them if you see blood sugars going below 100 milligram per deciliter in the mornings when you wake up, that's the time you start cutting back on your insulin by 10 to 20%. I sometimes give them numbers if they're not very, good at math. Tell them cut back 5 minutes at a time, etc. So every individual is different, and I may say cut back on your sulfonylurea prescription by 50%. But the monitoring blood sugars alongside the dietary changes and getting the guidance from the physician will make them feel comfortable, but also give them the right guidance to get it done without any adverse incident.
And for me, it seems like we can almost organize things into two camps. Somebody that is further along and they've been on drugs, say, for a while, they're type 2 diabetic and they're looking to go the other way, versus somebody who might be overweight, pre-diabetic, or starting into type 2 diabetes. And then they want to make the changes as more of a preventative from going into full-blown type 2 diabetes. two different beasts that you have to manage different ways, because one of them
And
involves drugs, the other doesn't. One, to me, and you can clarify this, if they're more in the prevention realm, they could probably do a lot of the stuff we're going to talk about, diet and lifestyle today, and hopefully prevent themselves from needing drugs and going further down that rabbit hole.
that is how it should happen, especially in primary care setting. Now, don't get me wrong, in primary care setting, doctors will talk to their patients about their diet and lifestyle, but it becomes a little bit of a tug of war because the physician sometimes approach that more paternalistic way. And in human psychology dictates that if you tell someone to do it, they will resist the idea. So we like we like the idea to come from the patient, and then you guide them through the right way. So if you tell your son, "I want you to be a doctor," they'll probably go become a lawyer, right? That's how human nature is. Um, so the way I approach is, what do you think you can do? What do you think we should do? Do you like to be on medications? Do you have any way that you can share with me to come off these medications? What do you think we should do? And if the ideas come from them, and let's say they give me three ideas, I can pick one. I can say, that's your idea. Let's go with that. Let's go walk with that and then see what we can do. But if I rarely ever tell people to change their entire lifestyle in one visit. It's just not feasible. Um, that's why a lot of people find me on YouTube, like on our SugarMD channel, because they are there to seeking information. They are there to listen to you. But in regular life, in my clinic, not every patient now is there just submitting themselves and say, I'll do whatever you say. Majority of patients in real life are referred from their doctors. They are at a loss. They don't know what they're doing. They have no idea to start with, where to start with. And for those patients, we have to be very gentle and easy and kind of get them step by step. But from your standpoint, yes, somebody who has been diagnosed newly, they are in a shock and they want to do things right. And that's the stage where you can actually bend that branch before they become like a diabetes veteran and they don't care anymore. And those people are harder to treat because they're like, I'm fine with the insulin. No matter what you tell them, insulin, how bad it is for them, whatever, they say, you know what, doc, that's fine. I'm tired of this because they think that they failed multiple times. They think that they're already a failure. When you think that you're a loser, it is very hard to convince that person otherwise that no, you can be a winner because they're already convinced that they're a loser. And we create those patients by pushing medications more and more and more, putting them in a vicious cycle, and eventually for them to say, okay, you know what, whatever, I'll take insulin and that's it. End of the game. But a newly diagnosed diabetic knows that it's reversible, it can be done, and they didn't lose their entire pancreas, right? So, yes, some people legitimately need insulin, right? Some people will really need insulin because they don't make any insulin at all. It could be a very advanced type 2, like 25 years of diabetes. They pretty much destroyed their pancreas. At that point, the moment, even if they go on a fasting, if they don't take a basal insulin, their blood sugars may rise. Those people are separate. But newly diagnosed within the first 5 to 10 years of diabetes, almost all diabetes is reversible with enough motivation from the patient.
All right, well, let's continue with our hypothetical here. Let's say we have somebody that's within that 5 or 10 years. They're motivated, and we've talked about the dietary piece, the Mediterranean low carb diet. So that's pretty self explanatory. But let's move into other modalities or lifestyle factors that you're going to discuss and educate your patients on that go along with the diet if they want to prevent themselves from going all the way down, all the way to a type 2 diabetic.
Right. I mean, the first thing is most people don't want to confess, but a lot of people engage in fast food, sodas, candies because of the holidays, because of the family. It is very hard to stay away from them. The best way to stay away from them is to not have them around, right? Out of sight, out of mind. I don't believe in willpower as much. If something is presented to you, you can resist once, you can resist twice. Third time, you're gonna throw the flag, the white towel. I mean, typically, what I tell them, stay away from the situations and the food, even when you're shopping, stay away from those foods that you know is going to hurt you. If you can start with that, that will give you motivation because you will see results. The moment they see results and they come back and say, "Hey, doc, look what I've done. I brought my A1C down. Look, I've lost weight." Then you can take them to the next level. Okay, let's think about it. Let's say, yes, you cut back on, you stop the soda, you stop eating sweets and all that, and you don't crave them anymore. Great. Let us, well, what else we can do from a diet standpoint? What is your relationship with potatoes and pasta and bread? And then we can get into those, and basically almost like they're like targets, we take them down one by one instead of entirely banning them. And I like to give alternatives as well. So I'm like, hey, have you tried this keto bread, for example? Or have you tried, if they are not going to be on keto, hey, did you try pumpernickel bread? Something that is less hazardous to your health than just simple white bread, for example. And people are willing to make those small changes that because psychologically it's a lot easier. So that's, and for someone who's newly diagnosed and motivated, for them, I tell them, look, fruits and vegetables, natural in moderation. I'm not telling you to give up on that and go on a carnivore diet. I don't believe in that. Just because I've never seen a single patient who maintain a carnivore diet more than a year. It is not humanly. Although there are a lot of proponents of it, but to me, there are very, very marginal portion of people who can stick to that diet. Plus, there is no proof that diet is healthy in the long term. The only proven diet in studies is a Mediterranean diet. And if you're a diabetic, low carb Mediterranean diet will help you with the blood sugars. And one thing that a lot of people don't understand, and doctors will do, but a lot of lay people will not understand, is your health is not just based on your blood sugars. And blood sugar goes up because you're at the end of insulin resistance cycle. This is actually a very late stage. What causes the heart disease and every other problem, fatty liver, etc., is the insulin resistance. So if you beat that at an early stage, you wouldn't be diabetic to begin with. But once you're diabetic, people get caught on the idea, okay, the only thing I need to do is bring my blood sugar down. Well, to me, your blood sugar can go down, but you can still die from a heart attack. So if you're not controlling other risk factors like your blood pressure, your cholesterol, and your exercise is not there, just because you're eating just meat only doesn't mean that you will not have a heart attack. So those are the things that we need to make sure that people understand, that their life is, or their diet is not just about controlling their blood sugar. Yes, it is very important, but the diet they go on should also allow to keep their blood pressure down and keep their cholesterol down as well.
I'm glad you brought up insulin resistance. We're going to get deep into that in a little bit, but I want to come back to carnivore and not specifically get into this diet. But as you're talking about that, it brought up something for me as you're talking about the long-term health complications potentially with a diet extreme like that. And what that got me thinking of is the fact that each individual patient is going to have a different timeline that we need to work on them with. Like some people might be 100 pounds overweight. They already have peripheral nerve damage. They're having problems with their eyesight. It's like, okay, we really need to do something extreme to bring you back quickly versus that person that's, just in that prevention stage, that first 5 to 10 years where they're just noticing a little bit of extra weight around their waist. And they're like, okay, I want to nip this in the bud. So I just want to make that point that along with what we talked about earlier, being cognizant of what that patient's goals and how their motivation is, we also need to look at them in a holistic approach to see where their health is and how extreme that might be already down the rabbit hole. And we need to pull you out quickly with something like a carnivore or a keto diet that might not be our long-term strategy.
Right. Well, I call that pushing on a reset button, right? So what happens is I tell them, look, your pancreas is now, think like flooded. Like if your house is under flood, what do? You have to take an extreme measure. You have to cut that sugar immediately, get everything back to normal, and then think about what to do next. Yes, exactly right. So when your body is flooded with excessive sugar, you have to cut it off entirely for a short time to get metabolism back to its normal stage. I call it again like a reset button, and then help your body heal a little bit. and then we can introduce healthy carbs and in moderation, instead of asking to stay on that diet forever. But yes, exactly right. So you put people on keto or carnivore, and then guess what? If they like it, they can stay on it as long as we monitor their parameters and their health, right? And everybody is different. Some people will have a tremendous spike in their triglyceride levels even if they're on carnivore diet, and some people will not. So there's so many genetic variability in people how they respond to different diets. As a result, we cannot just tell everybody, yeah, this diet will work for everyone, and this diet is gonna be bad for everyone. Uh, we cannot say that. So as long as they're under their primary care doctor or endocrinologist monitoring them, their health goes in the right way. Their cholesterol is better, their blood pressure is better. They like the diet, they can live with it. We want people to have a life. We don't want them to say, "Oh yeah, your blood pressure and cholesterol good," but they come and tell you, "Doc, I hate my life. I can't stand this diet." Well, then we have to say, okay, well, let's just find a way that, like a compromise, see how we can make you happy and still keep your health parameters in shape. It is, again, it's not a one-way street. We work with the patients and see what they're willing to do, what they can do, and then how fast they can do it. That's why you're right. Hey, let's try the keto diet, see what happens to your parameters, metabolic parameters. You come back and you tell me how you like your lab results, how you like your blood pressure, and then you tell me how you like the diet, and then take it from there. But giving that chance to people, having them a try instead of blocking, no, keto is not going to work for you or carnivore is not going to work for you, is never the right approach, because again, it's not a one-way street.
Let's come back to the insulin resistance piece and let's get into the physiology. Talk about what happens when somebody consumes carbohydrates or sugar. We'll start with blood sugar rising and get into the insulin.
When you're not insulin resistant and you're an athletic individual, you actually need a lot of carbs. Why? Because carb is the primary source of muscle's immediate energy source. Sometimes I will joke with my patients. I'm like, "Are you into marathon?" I know they are 250 pounds. I'm like, "Do you run marathons?" They'll say no. Well, do you exercise 2 hours a day? They'll say no. And I'm like, "What do you eat the carbs for? What is that cereal for?" Because if you eat that cereal, your body needs to use that energy right away. If you're going to go for a marathon, yeah, you need that. But if you don't, it's going to go to fat. And what happens when that goes to fat? Your fat cells, they don't proliferate, they don't multiply, they stay in the same number. So whatever the fat cells you have in your 2-year-old, you have the same number of fat cells. They just grow. And I tell them, look, in this room, there's you and I here. What if I bring 10 more people in this small room? How would you feel? They'll say, "Oh, well, I can't even breathe." Well, that's how your fat cells feel like. You're packing all this fat from unused glucose turning into fat, and then your fat cells grow and grow and grow, and they start secreting inflammation signals. It's like you yelling here, "Hey, save me. I'm dying. There's no air here." And your fat cells are doing the exact same thing, releasing all the cytokines, inflammatory markers, and then that makes you insulin resistant, because then those inflammation will prevent the insulin from doing its job. Think like bunch of gunk coming out and blocking the receptors of all the inflammation, disturbing the receptors. Now insulin cannot attach to those receptors because of the inflammation released from the fat cells. So the process starts from, so if you're an athletic individual, you're not overweight, and you exercise and your cholesterol looks great, you have a high HDL, low triglyceride, you work out every day, guess what? Eat your banana, eat your cereal, go ahead, because you're burning it. Because if you're athletic and you're going to burn, and if you don't eat carbs, you're going to feel extremely fatigued. So that's why people on carnivore and keto, we don't recommend them like intense exercise, because they can't simply do it. Your body needs carbs to exercise for athletic purposes. But if you're not the type of person who does all these things, there is no point of consuming all those carbs. It's going to turn into fat and it's going to come back and haunt you.
All right, let's come back to the physiology piece of the fat cell growing, causing inflammation, gunking up the insulin receptor. What happens to your body at that point? The way I understand it, when that starts happening, you're going to make more insulin and try and drive that glucose into the cell, even though it's not wanting it. But I'll have you explain the nuances there.
It's more than that, actually. So this very simple explanation where insulin cannot get into cells. But what happens is insulin can get into other receptors. So when there's a lot of, so you knock on one door, that neighbor doesn't respond to the door, but next neighbor may respond to the door. Now, the same insulin will go and activate other things. Like in females, for example, it will activate androgen receptors, and they're going to create a lot of testosterone, and that will create PCOS, polycystic ovarian syndrome, where excessive insulin is leading to excessive androgen formation, like testosterone formation in females. Now, that's one problem. Another problem insulin can cause is it activates renin-angiotensin system in the body, which is the primary driver of endothelial dysfunction. Now, what is endothelial dysfunction? Endothelium is the lining on the surface of your arteries. So the problem with the atherosclerosis, which is clogging of the arteries, all starts with endothelial dysfunction. And for that to happen, you have to have renin-angiotensin system overactivation, which we call mineralocorticoid receptor overactivation, which results in endothelial dysfunction, and then think like cracks on your walls in your house, basically, right? So it can leak, the humidity and all sorts of fungi, all sorts of problem, mold, right? So that's what's happening to your arteries. And then all this LDL, the pesky LDLs get into your endothelial cells. They start growing. Macrophages start attacking that because they say, wait a minute, you're not supposed to be here. What are you doing in my house? Get out of here. Now, macrophages start swallowing LDL. And then every time there's a macrophage, like a sinus inflammation, you're going to have mucus coming out of everywhere. That's the inflammation byproduct. So as a result, that triggers more inflammation, and immune system goes into a frenzy, and suddenly platelets come there. Everybody comes there. It's like there's an accident. You see ambulance, you see everybody, and suddenly the whole road is freaking blocked, and nobody's going anywhere. If you're going from here to Miami, you see that every day. So that's what's happening in your artery. These are the arteries of the cities, the same thing you're causing. Think like if you have potholes in your highways, that's going to create accidents, and suddenly all these inflammation markers, all the ambulance and the police and everybody will be there, and then suddenly the road is blocked. You're not going anywhere. That's what's causing the heart attacks at a very early stage, even way before diabetes is diagnosed. So insulin, yes, you're insulin resistant for glucose, but a lot of other tissues are still sensitive to insulin. And what's interesting, fat cells continues to become more responsive to insulin than the muscle cells. So as a result, what's happening is you have all this glucose running in your system. They are not going to the muscle because muscle is more insulin resistant than the fat. But the fat says, you know what? Come on in. We have more room to go. Come on in here. So insulin keeps packing the glucose into fat cells, and that creates more problems. It's like you have someone on the door at the gate in a club, and then the guy says, yeah, come on in, come on in. The guys inside says, wait a minute, this is getting too crowded here. But the guy at the gate says, oh, you need to make more money. Come in, They just keep get in the club. Everybody in there is dying, but the guy at the front says, keep coming in. That's what's happening with the fat cells. Insulin still packing glucose into fat cells, whereas, across the street, the healthy salad bar is not getting anything. There's no customers there because, that they are more resistant to the action of these people going in. So the body works weird in a way that the insulin resistance is not the same in every tissue, and that's a big problem.
Let's talk about what the body does when it comes to making more insulin when insulin resistance starts.
Well, anytime there's a resistance, your body does anything to overcome it, because glucose is a vital, most important nutrient in your system that needs to be utilized. Otherwise, it goes into pathways. If it doesn't go through the right way, it goes the wrong way. Like if your son doesn't go to the college, he may go join a gang, right? So there's different pathways people take, and glucose, if it doesn't go the right way, it's going to go to the different pathways that creates inflammation or more inflammation. And body knows that and wants to increase the insulin so the glucose can be utilized, but with the expense of causing more damage to other tissues. Think like if your door is kind of a rusty and you want to open it, and then you're pushing it hard to open it because there's resistance at the door, and then you're pushing it so hard that it eventually opens and you hit something and now you broke something else. So insulin resistance insulin increases trying to achieve to keep the glucose levels normal, but while doing that, it's causing all the other damage in the other organs.
Got it. And then where my mind goes next is the fact that what a lot of doctors do when they get to that point is they put patients on insulin, and we're further putting logs on the fire and continuing that cycle. Talk about how you think about that.
Right. So actually, there has been a paradigm shift in that approach. Um, we used to say, oh, go ahead and start insulin because you have to bring the blood sugars down. The point of that is we don't want kidney disease, we don't want eye disease, because we know when there's too much glucose and your body cannot compensate for the extra insulin, then you have to give the insulin to keep the glucose down. So what you're doing is keeping the glucose down, but you're not preventing the damage that the same thing happens without insulin, giving insulin from outside. Even if your body makes the insulin or you are taking the insulin from outside, the damage still happens to other organs. Now, yes, you are fixing the glucose. You may be preventing kidney disease. You may be reducing the risk of eye disease. But guess what? We found out that they die from heart attack and stroke way before they even develop kidney disease. We call them, they're lucky if they go to dialysis, because most of them will die from heart attacks because of the insulin, or they will develop cancer because of the insulin before they even lose their eye. Like, there's not that many people losing their eye from diabetes, but 2/3 of diabetics die from heart attacks and strokes because of insulin resistance. So that defeats the purpose. And yeah, you're trying to save, you're trying to make an investment that you will make, $1 from $10, but then you're losing $5 like months before you make $1. So then there's no point of investing in something like that. So it's a bad investment. So you're trying to control something and breaking something bigger. Now, for that reason, from a medication standpoint, right? So I'm a holistic guy. I do medications and supplements and lifestyle change. All has to be together. But from a medication standpoint, they realized that, and they came up with 10 years ago or so with the GLP-1 agonist agents. Now, what these are actually intestinal hormones. Like you heard the the talk recently about semaglutide, Ozempic, and Trulicity or Mounjaro. They're gastrointestinal hormones that gives you the appetite, or the satiety signals, and that tells your body that there is food in your system. So calm down, don't eat. Now, these medications also have been shown to reduce the risk of heart attacks at the same time, because guess what? You don't eat, you're going to have less heart attacks. And there's other mechanisms involved as well. Same thing with SGLT2 inhibitors like Jardiance and Farxiga. What happens is they basically pee out the sugar, so the sugar doesn't stick in the system, and their blood pressure comes down, and other indices comes down, and as a result, it reduces cardiovascular risk. Now, what's the problem with that approach, right? Let's use medications. Well, here's the problem with that approach. They cost us a lot of money. So it's like you lost your bicycle and you go buy a Ferrari to go from A to B. Okay, well, can you afford that? Right? Yeah, Ferrari can get the job done. I'm not saying it can't, but then we are the one paying for all those expenses, and we pay $300 billion for diabetes related expenses every year. Now, we can't put that money into our education. We can't put it into our technology and development, instead of paying for these medications that we don't have to if we fix the problem at an early stage as preventative measures, right? Um, that's why, yes, medications, if somebody have to have medications and they are not going to change their lifestyle, I'm glad we have those medications. I'm not against those medications, but I think it is premature to put people on insulin or put people on these medications too quickly before giving them a chance to do changes in their lifestyle and so forth.
I totally agree with you. It's one thing if somebody's taking a medication because that's the only way, and they have we don't even need to use a specific disease or disorder. But it's another thing when the information we're talking about today is out there. And of course, we need the right people to come in contact with that information. They need the motivation. They need to come across it before it's too far down the rabbit hole. But for a lot of people, there are things, again, coming back to what we're talking about today, that they can do. So it's like, let's get to the root of this and get you healthy in general, fix your metabolism, and save money. It's a win-win-win all around.
Correct, exactly. And that needs a lot of education. And here's the problem with the system. Our healthcare system does not pay for education. You will see on my YouTube channel, everybody complains, oh, I'm so glad I found you because my doctor never talks any of these things, right? Why would he? Think about this. A doctor is there, he is there to make a living, and he's forced to see so many patients to maintain his salary, okay? You as a person, you have a job. Everybody has a job. Doctor has a job too. And they're not incentivized to give people education. They're incentivized to push medications. They're incentivized to see more people. So as a result, those people don't have anywhere to go for education. Insurance companies don't pay for education. They will pay for a heart surgery for $300,000, but they are not going to pay a doctor to sit down and talk to their patients like $100 for 30 minutes. They're going to refuse to pay for that. And that's a huge system problem. And everybody knows. You think the doctors don't know these are the facts? They know these are the facts. They know that if they change their lifestyle, they will do better. They know ketogenic diet will work. They know low carb diet will work. They just don't get paid for talking about those things. They just simply don't. And they rather give the medication. And insurance companies will say this, look, if your A1C is not down by 3 months, we are not going to pay you, or we are going to cut back on your reimbursement. So you better get this done right now. What's he going to do? He's going to pull the insulin because that's the fastest way to bring the blood sugars down, because he doesn't have time to preach the patient. He doesn't have time to educate the patient. He's just going to say, let's use our big guns. Let's get it done. And that's a huge system problem that they do a better job, by the way, in the UK, for example, in European countries, in terms of preventative medicine. But in the United States, we are not even close to that. And with the workforce of so many, we really lack, there's a significant shortage of doctors. And with that being in mind, and doctors, family doctors, endocrinologists are not getting paid for educating their patients for metabolic health, I don't see that getting fixed anytime soon.
But do you really feel like most doctors are aware at this level we're discussing today? Because I feel like a lot of the focus in the medical world is on the blood sugar, and we're taking it to the root with this conversation and talking about insulin, and how a big part of the insulin piece is the fact that things can go on for a long period of time in the body, and insulin can be awry behind the scenes, and we're not measuring it, causing all kinds of haywire and destruction. Do you feel like most doctors are aware of that when they're, prescribing
So,
drugs, just trying to bring the blood sugar down?
yeah. So I agree with that. So what happens is the doctors have general information about dietary changes, what can help the patients, but they don't necessarily have in-depth knowledge about insulin resistance and consequences of the things we talked today about, that I may try to make it more simple. I know that because sometimes I will talk to other physicians, I give talks and stuff, and they look at me as if they are hearing those things first time. I can't see on their face. So to me, it should be a common knowledge. But to your point, yes, I'm not sure if all the doctors are in tune with in-depth knowledge about the consequences of insulin resistance. Most of the time, they either forget, maybe in a busy life, they're in a busy schedule and they don't necessarily go back and look at their data and study it again. And like I said, they get busy with prescribing medications, and diet becomes just something supplementary, not the main thing. And that should change, because 90% of our health is relying on our diet. But like I said, even in medical school, they don't teach that much. I mean, I personally started studying this around 5 to 8 years ago, the dietary approaches and holistic approaches. Before that, I was just another doctor who just thinks about medicine and just wants to prescribe medicine. They have to open their eyes and have a different perspective and try to understand more about insulin resistance if they want to save their patients.
And when it comes to your story, you piqued my interest there talking about 5 or 8 years ago when you got into this whole new world of alternative treatment of blood sugar and diabetes. What was it for you at that time? Was it something going on with your personal health or the health of a family member? Because most doctors, go through their whole career and they're not pulled into this kind of conversation that we're having today. So, what was it for you?
So for me, it was I had a passion for diabetes all the time, and I like to listen to my patients, and I like to understand the barriers. So I realized that giving medication is not the only solution for most cases because there's so many barriers. Number one, they're expensive. Most people cannot afford them. And also, even if they go on medications, people develop tolerance to medications, and eventually medication wears off, and we are back to ground zero. I'm like, wait a minute, scratching my head. What did we do wrong here? I just thought this medication will fix everything. And down the road, their A1C is still going up. They still have high cholesterol. They still have high blood pressure. It is constantly adding medications, and they come back and say, Doc, I'm tired of adding medications. What are we doing here? We're not going anywhere. And I think to myself, there must be something better for my patients other than just giving these medications. Then, I started looking further into, but you have to have this initiative inside um, to think about can I help my patients better than the conventional methods. And then when I came to realization that there is way more to what we are doing in clinical practice that I can help my patients with. And that's how the SugarMD was born. When I first started my YouTube channel, I didn't think about it was going to get that big, but I realized how people were so thirsty to information. And that motivated me because I realized that how people are so thankful, how they appreciate you so much because they don't hear those from other people, especially from their doctors. And I love to be of help to them as like filling the gap between their doctors and their medications, their regular healthcare, and this integrative approach that we are trying to implement.
And the cool thing about this world you're in, diabetes, weight loss, there is a lot people can do on their own. So when they find your YouTube channel, depending where they're at along their health journey, they can do a lot without necessarily even seeing a doctor. And unlike a lot of other diseases out there is a solution to this for a lot of people. So it must be really rewarding for you versus somebody. And, we need doctors that do all different things out there and work with people that are terminally ill and don't have different options. But in your case, it must just be so rewarding because by conventional docs, a lot of these people have probably been told that, this is progressive and chronic and you're just going to keep upping your medications over time. And diabetes is something you're now going to live with for your life. And then for them to come across your YouTube channel and realize, I have some power in this, and it's just got to be so empowering for the patients.
Exactly. I mean, so it comes boils down to semantics as well. And people need to understand that labeling something does not make things change, right? So you can what we call is in supplement manufacturing. A lot of supplement companies will do that. They do white labeling. They will buy a product and they'll put their label on, and suddenly it's theirs. Well, not really yours. It's just labeled differently. With the diabetes, we label people with diabetes. Well, it's the same problem they had to begin with, insulin resistance. Now their glucose is high. You call them diabetic. Well, hello, you had the problem 10 years ago. It didn't go away, actually. Diabetes is just a bad word, that we label people with, and it's like a stigma. Oh, you're diabetic, and now you're diabetic. Diabetes is just a high blood sugar. It's nothing else. Insulin resistance is the bottom line, and if you reverse that, great. Then you can reverse everything. However, one caveat to that: when people really abuse their body, okay, for many, many years and decades, and they end up with diabetes, and they still don't realize, they are in denial, They keep doing what they're doing, and they use another 10 years. At that point, it becomes harder and harder. It's like going into debt. Now you borrow at $1,000, then at $10,000, then $100,000. Eventually, it becomes very hard to pay back that debt. When you harm your body for so long and you become a very severely uncontrolled diabetic, which is half the time, more than half the time, they come to me like that. They're you can call them train wrecks. Um, it is still possible to reverse diabetes, but it's going to be a lot harder. So I always tell primary care doctors, you are in the front line. You're the one to catch that patient at an early stage before diabetes, even pre-diabetes or before that, to 100% reverse a lot easier. Otherwise, because what ends up happening is our beta cells, the insulin producing cells, they die in the environment of high blood sugars. So we continue to lose beta cells as we go along the insulin resistance. By the time people develop diabetes, they already lost 50% of their pancreas. That doesn't mean that it cannot be reversible. I give this example. Like right now, after 20 years of insulin resistance, finally you're diabetic. It's like your pancreas retired, didn't die. All right. So that's an important point. Retired from making as much insulin as it used to. Now you're making less insulin. Now, what you have to do, if you retire, what you do, you make less money, you adjust your lifestyle, you buy a smaller house, you buy a smaller car, you go out less often, whatever. With diabetes, exactly that's what you need to do. Your body is still making insulin, not as much as before because you kind of used it up too much, you abused it, but you still have a lot of hope to be able to use the rest of the insulin, which is plenty enough if you were on the right diet. So God gave us millions of beta cells. You know why? He knows better. He's like, they're going to screw themselves up. Let me just give millions of cells so that if they die, even if they go down to 50% of these beta cells, they can still live with it. But if you become coy and say, you know what, that's okay, I don't care, I'll just do whatever I need to do, you may end up going down to 20%, 10% of the beta cells. Then at that point, you're insulin dependent, even with type 2 diabetes. Then it becomes really difficult to reverse unless you eat no carbs whatsoever. And even then, because of the fatty liver and all the other issues, you may need insulin. So I tell my patients, don't go there. Don't put yourself into that situation. It is too early. A1C 10% doesn't mean that your pancreas is dead. A1C 14% doesn't mean your pancreas is dead. It's just a temporary crisis situation in your body. Like you said, push on the reset button, go back to normal, and don't go back to your lavish lifestyle that puts you into debt to begin with. So learn from your mistakes. Now inherit this new lifestyle and live a medication-free life, which is possible. Now, sometimes it's easier said than done. The problem is people don't realize until they're 50, 55 and they get diagnosed with diabetes, it is sometimes hard to change people at that age. That is my biggest problem. It's easier to change people in their 20s, 30s, maybe 40s. So that's why insulin resistance stage, when your triglycerides are high, your abdominal circumference is getting bigger, you start getting elevated liver enzymes and stuff like that. Way before diabetes or pre-diabetes is diagnosed, intervene and never go there. But lifestyle, especially sometimes when I say South, people get mad with me, but I mean, it's the truth that lifestyle in the South side of the United States is a little more lenient, relaxed with the food, especially it's a lifestyle. It gets really difficult, especially after a certain age. So that is, I think, the key point today, that it's never too late, but the earlier you start, instead of postponing, the better to reverse diabetes.
Earlier, we talked about some of the complications that can happen in the body if blood glucose goes awry in insulin. I really want to make sure we hammer home this insulin resistance piece. And you talked about somebody going around with that for 20 years before finding out they actually have a problem. Let's talk about what mechanisms are happening in the body to compensate as they have insulin resistance in the background, because there's this beautiful paradox with the body. It's very resilient and it can compensate. But in the case of insulin resistance, it's really good at masking what's going on behind the scenes, which in the end, if you're you don't catch it in time, it's causing a lot of destruction behind the scenes without people knowing. So what I'm getting at is let's talk about that physiology that's happening in the background where people can go for years, their insulin's out of control, destroying their body, and they don't even realize it.
There's not enough screening for insulin resistance in general population, and that's because again we practice medicine in a reactionary way, in a not a proactive way, right? Um, when people gain weight and you start seeing some problems, their cholesterol or their waist circumference and their blood pressure, etc. Even before that, we need to educate people, even in the college, even in the high schools, that what would happen if you gain weight. Gaining weight, most people think it's just a cosmetic problem. It's not. What happens when you fill those fat cells? What kind of nasty inflammation comes out of it? Why you're so fatigued? Why you're so tired? Why would that happen to begin with? It will prime people much better to prevent from gaining weight and maintaining a healthy lifestyle rather than waiting something disastrous to happen to take action. In our health system, we like to put codes, right? Diagnostic codes. When you put, like, they didn't even recognize obesity as a disease until recently. Insulin resistance was not a disease. They didn't accept that because there was no drastic consequences, like immediate consequences. Like, it's not like a heart attack, you have to go get a stent. So as a result, it goes under the radar for a long time unless somebody points out, hey, I see this and you got to do something right now. And the problem is, again, human nature. Let's say you're a financial advisor, you tell people, hey, you put your money into this mutual fund or whatever in the stocks, and it's going to grow in 20 years, or your retirement account, you will do well. What do people do? 20 years, way too far, right? So that's human nature. People want immediate rewards. So with the health, we tell people, hey, if you gain weight, this is what would happen. You develop diabetes. But people think that, it wouldn't happen to me unless they are really scared from their family members, like diabetes in their family and stuff like that. Um, but it requires repetition, constant education, and maybe education at an early stage, like really young stage. I think it should be in the curriculum in every high school and college and stuff like that, that consequences of weight gain and insulin resistance to anybody. Um, if for astute clinicians, they will check insulin levels, glucose, they're going to calculate HOMA score. People like to see things more materialized instead of getting some sort of haphazard advice from a doctor, right? Because when you say, hey, look, you have this, and it attracts their attention. Um, so clinicians can do that to get people on board with their treatment plan in terms of their diet and exercise, suggesting that you have signs of early problems. Same thing for kidney disease, heart disease. It should all be done. But what ends up happening is we catch them so late that, oh, well, I think you should go get a stress test done. And maybe next thing you go get a stent placed. But if you told them that insulin resistance would have caused that 10 years before, that would have never happened.
And when it comes to testing and realizing there's a problem with insulin early on, is a fasting insulin test the only objective way to really know what's going on there?
So actually, the insulin levels go with the glucose levels. It has to be, in correlation. Fasting can help, but actually, yes, if you are spiking insulin after your meals, and let's say your blood sugar is 90, your insulin level is 10, that's fairly acceptable. But if you eat food and your blood sugar goes to 150, your insulin spikes to 80, 90, now you tend to think that, okay, well, your insulin is spiking way more than it should compared to your glucose. So that when some clinicians don't get that, and that is the problem, because if somebody's glucose is 90, their insulin will be low. Why would their insulin be high? Um, but if you check glucose and insulin haphazardly after a meal, whatever, and you look at the glucose and in that, and then look at the insulin at the same time, then you can say how high the insulin is really going compared to glucose. Because like normally you shouldn't go over 120 in a perfectly healthy pancreas. But if your insulin is going so high, it's like your car is revving the engine to be able to go over a bump. Like you'll be like, what's wrong with my car? Right? So the same thing in the body, if your insulin goes so high to maintain your blood sugar, you have a problem. To your point, yes, insulin at a fasting state can be an indicator, but it's not the only indicator.
So when you're working with patients, what kind of lab work will you do when it comes to insulin? Are you testing just after meals then with the blood glucose, or what does that look like?
So I typically test it at fasting state, and that gives us a good HOMA score. But if they have fairly good insulin and good glucose levels, that maybe they're because what happens in the diabetes and insulin resistance world, the first defect actually starts happening, the insulin production defect starts happening also postprandially after a meal. So if we think everything looks fine on the fasting, then we go for the next stage. You can do a mixed meal test, have them eat a mixed meal with protein, carbs, and fat, and then check their insulin and glucose, and then look at that. And interpretation of that test is not universal. It is somewhat subjective, but it is, I think if you have enough experience with it, you'll be able to understand what's going on.
Is there any other blood work or testing you like to do with your patients?
So actually, Quest and LabCorp, they offer insulin resistance scores, for example. So they look at their triglycerides, their LDL, their HDL volume, their HDL particle size, LDL particle size. Um, when you're insulin resistant, you will have higher number of small LDLs and a small number of large LDLs. So your HDLs will be tiny, your LDLs will be tiny as well, and that can tell you about insulin resistance as well. However, the problem with that approach is it's not paid by the insurance companies most of the time. So I always disclose patients, hey, we can order these tests, but I want to make you aware that you may get a bill about this. But most of the time, you don't have to run a lot of tests to know somebody's insulin resistant, right? So it's mostly clinical. You can tell. Look, if somebody has a skin tag on their body, they have already acanthosis nigricans on their skin. They have abdominal circumference. Their skin is not right. You can tell their skin is rough, dry. There's so many clinical clues that you can pick as a clinician to say, oh, their eyes don't look right. They're saggy and ballooned so you can see that they're inflamed and there's edema in their body. What's the point of running a test? You already know that, right? So you already know. Now, sometimes I do the test to convince them, yes, you do. If I tell them, hey, you have insulin, they'll say, based on what, right? Because we trained patients as doctors to keep testing, right? We have to run an MRI to diagnose something. We have to, the physical examination and talking to the patient is gone. Those days are gone. So doctors just want to order tests and tests and tests. And now patients think that they have to get a test to get a diagnosis. But if you're a good clinician, you can just look at your patient. And they used to teach us in medical school, the moment the patient walks into your office or you walk in, the first observation, that's 50% of your diagnosis. You can tell by looking at like acromegaly patients, right? They from their facial features. I had some endocrinologist, my mentor one time. He told me he diagnosed people in the grocery stores, which is a very rare disease, by the way, like 1 in a million kind of thing. But he's paying attention. He says, maybe you should get checked, for acromegaly because your teeth doesn't look right, your nose doesn't look right. So but as a personally, when I look around, yeah, I tell people like this is insulin resistant, that's insulin resistant because I know what I'm looking at. So the bottom line is they have a lot of features, signs, and symptoms that you can tell that they're insulin resistant, but there are tests to prove the point.
Given the fact we've talked about how insulin resistance can often, be occurring behind the scenes for years before somebody finds out, given the work you do in diabetes and working with people and their insulin levels, I'm just curious, how many people do you feel have insulin resistance and they're going around day to day feeling like they're healthy, but they have no idea that underneath it all, their insulin's all over the place.
Right. So I would say that's probably 60% of the population
Wow.
because we have 70-80% of the population in the US is overweight. And I would say at least 50-60% of people are insulin resistant without knowing it.
So we talked about the diet piece. I want to come back to this. We talked about the low carb Mediterranean diet being a good, at least starting place for your average person that wants to start regulating their blood sugar. Let's talk about specific things people can take or do. Say they're following that diet day to day, but it's the weekend and they're going to go out to dinner with friends and maybe have a little bit more carbs than they usually would. What are some things, knowing they're going into that situation, they could bring with them and take or do afterwards to help control the blood sugar? And I want to caveat this. This isn't just so people can go out there and abuse what they're eating, but people that are being conscious and they just want to regulate within a more narrow realm when they quote unquote cheat.
Yeah, I guess, you're referring to like going eating outside and things like that, or what they can do.
Just, simple things such as going for a walk after the meal or before the meal.
I see. Yeah.
Simple things
Right.
that they can include supplement wise or
Yes.
different things as they're
Right.
eating to
Right.
help keep the blood sugar under control.
Definitely. So, to the point, remember we talked about the marathon example. If you're gonna go for a marathon, go eat your cereal. That's I don't care, right? Because you're gonna burn it off. Yeah. So I do the same thing. Look, I don't live a very low carb diet personally because I'm very athletic. I go to gym 1 to 2 hours every day. I need some carbs, at least healthy carbs, so that I can perform at the gym. And for those people who will go to a party and they know they are going to end up eating something that they wouldn't normally eat, for them, yeah, take an extra walk, especially after meals. I do that with my family every evening. I after a dinner, going for a walk is the greatest thing. Most of the time, what ends up happening is people, especially that's why I told you like when people are older, it's harder. They'll say, "Oh, I have a back pain, I have this pain, I have that pain." People like to give excuses, but I tell them, look, there's so many things you can do. You don't have to even get out of the house. You can do home exercises. You can do water aerobics if you have a pool. There's so many things you can do. Yes, activity, exercise is the best way to be able to prevent insulin resistance and blood sugar spikes. 'Cause if you use the glucose, there is nothing to turn into fat. Simple as that. You use that to your advantage. Now, it's not to abuse. Sometimes people will say, oh, yeah, I'll eat this whole cake and I'll go exercise. Well, exercise is overrated. So you will burn 300 calories in an hour, but you will eat that 300 calories in less than 5 minutes. So you have to be careful there. So exercise is not a replacement of a good diet, but yes, if you had something extra that you wouldn't have otherwise, go for a little walk, go do something extra to remedy that problem, but don't use the exercise to deceive yourself to say that, oh, I'll exercise. Well, first of all, if you eat a lot of carbs, you will feel tired. And it's very unlikely for you to go for a walk after that, right? So I'm telling you that that exercise can be a backup, but you should not use as an insurance for yourself to tell yourself that, oh, yeah, I'll exercise. But yes, you did something that you know you were not supposed to. Now you feel like guilty about it. Okay, sure, go ahead and exercise. That will definitely help. Now, from a supplement standpoint, I tell a lot of my patients, look, we have this SugarMD Advanced Glucose Support, which works great to prevent the blood sugar spikes. It's totally natural. Um, but of course, I don't want you to keep taking that necessarily. So if you're on a low carb diet, you don't have to keep taking it. But if you are eating some carbs, incorporate that to prevent the blood sugar spike, which helps great. And even for herbal and supplement world, we don't necessarily like, although I'm selling it, I'm not pushing them to say, oh yeah, you have to keep taking this. No. If you're on a good diet, you're exercising well, your numbers are good, there is no point of taking anything extra. Well, on the other side, yes, there are certain things, certain herbs can help you in other ways. Taking a small amount daily will help, but again, supplements are never a replacement for a good diet and exercise. I always tell them that even you think you're taking natural supplements, that's not a replacement for your low carb healthy diet.
You mentioned your supplement there, but what about things that people already have around the house, like apple cider vinegar or taking cinnamon with the meal? Any specific hacks, things people already have in their kitchen that they can use?
Definitely, that I have videos about these all the time. So they can mix up whatever they want in terms of elixir. I give elixir examples in my videos. But for example, using hot tea after dinner and adding some Ceylon cinnamon, which is better than a regular cinnamon. Regular cinnamon has a lot of drawbacks to it, especially if used excessively. But Ceylon cinnamon is much better. You can use turmeric if you're okay with the taste, but Ceylon cinnamon, some apple cider vinegar, not too much, just as 1 tablespoon, and you can use olive oil together with that. People think that it may be gross actually, but it's not. And on your salad, why not make a habit of putting lemon and apple cider vinegar, which is the essence of every Italian dressing. That's a Mediterranean diet right there for you. So if you don't want to make drinks and stuff like that, make sure you incorporate those things to your daily diet, your lemon and your apple cider vinegar, which gives you vitamin C. Apple cider vinegar gives you vitamin C, a lot of antioxidants. Because with diabetes, you have a lot of oxidation, a lot of damage to your body. So you have to bring in all the antioxidants to negate that damage. But to your point, incorporating those things into your diet is the best way to go. Now, some people will say, no, I didn't grow up with this. I cannot put vinegar in anything. Okay, well, then get some gummies maybe, and that's not going to hurt you, but naturally using in the diet. I have patients from India. They'll say, "Oh yeah, I know there's a bitter melon in your supplement, but we eat bitter melon." I'm like, "Great!" And they'll tell me that when they eat bitter melon that night, next morning their blood sugars are great. Yeah, so use everything natural to your advantage to make sure that you are giving your body a chance to recover from other antioxidant damage.
How do you feel about the order we eat things? So if you're going to have, say, a potato as part of your dinner, having, say, the salmon first, then the broccoli, and then putting the potato at the end of the meal, talk about how that impacts blood sugar.
One thing that I like in American diet that when you go to a restaurant, they serve you salad first. And then by the time of the main course, you're like, oh, well, maybe I'm not going to order the main course. Because when you have a good salad before your meals and a soup, you will be full. So if you start every meal with a nice soup, a healthy soup and salad, you will realize that you don't really need that extra steak and potato that you would eat otherwise. And that is the perfect example of a plant-based diet because you're filled with mostly vegetables and you didn't have to put extra protein or extra fat in your body that has to be processed, and that helps with the weight loss and so forth. So, yes, the order of things, your appetite. Well, that's why we always, even dessert, right? You want to have a dessert? Yeah. Even your parents will tell you when you're a 2 year old, don't eat the dessert in the beginning because if you leave it at the end, you may not want to eat that dessert. And that's a very well point that everybody should practice, that leave everything that you want to eat right now to later. And maybe more than likely, you may not want to eat that.
And correct me if I'm wrong, but I believe even adding fat and protein, say you're going to have just a potato, but adding, a bit of butter to that or adding some fat and protein
Will
will
slow down the
alter
spikes.
how quickly that spikes and it won't spike as
Right.
quickly.
Correct. Um, because any fat actually in your body, let's say you put a lot of olive oil. That's what I tell my patients. Put all the olive oil you want on your salad, and that will slow down the absorption of anything else because any fat in your stomach will slow down the process of absorbing anything that includes the carbs. So yeah, if you're gonna eat a carb and you eat fat and protein first, it'll definitely help prevent the spikes.
Let's get into intermittent fasting. This is a really simple, free, powerful tool for people that want to start to manage their blood glucose and bring their insulin resistance down. Talk about for the newbie out there who is again going to take on some of the dietary stuff we talked about, but wants to layer on and add this in as a tool.
So intermittent fasting is kind of a challenge, especially in the United States, because people are not used to fast. People are used to eat every 3 to 4 hours here. Now, what I tell them, look, I'm not telling you to go 18-hour fast. Start with whatever you can do. Start with 6 hours, 8 hours, maybe delay your breakfast a little bit, and then extend that fasting period. It's like, when you're exercising, you don't go and run for 2 hours. You start with 15-minute walks and then go to a run and then keep increasing your pace. Same thing with the dietary approach. You just have to increase that duration of fasting so you get accustomed to it. Otherwise, asking people to fast 16, 18 hours is just a big challenge. But they'll get there. They'll get there, eventually. And then they'll say, oh, well, now I fast 24 hours. It doesn't even bother me at all.
How do you feel about somebody putting resistance training into their regular routine to build muscle? And specifically when they start putting on healthy muscle, how does that impact their blood glucose?
So muscle tissue is very active in terms of picking up the glucose. And most of the time, it doesn't need insulin. So as a result, even type 1 diabetics, they can go without insulin. Normally, they can't. But type 2, type 1 diabetics, they can go without insulin if they are exercising. So we tell them sometimes, even for young kids, they run around all the time. And they're in a camp, diabetes camp. We take their insulin pump off because we know that they're not going to need anything for a long time. And when you build a muscle, you have more tolerance to carbs because your muscle will be able to take that glucose in. When you don't have enough muscle, or when you're constantly overfeeding yourself with glucose and fructose, then the muscle tissue will be filled up with excessive glucose and fat and then become insulin resistant. But if you have more room, like the earlier example we gave, I tell my patients, if I bring 10 people to this room, what would happen? Well, if you have a bigger room, it may not be a big deal to bring 10 more people if it's a big room, right? So if you have bigger muscles, then you can tolerate more sugar coming in because then your muscle will take the glucose in. Now you have to burn that's for sure. And you go exercise, you burn this, you build more muscle, more glucose coming in, no problem. As long as you're building muscle to burn that off. But if you are taking more glucose than the muscle you're building, of course, you have to have that balance where watch your weight, right? Weigh yourself every day. If your muscles are growing, you don't want to grow fat as well. So in most cases, when people grow muscle, they grow some sort of fat. If you're growing lean muscle, if you want to grow really lean muscle, it's not going to happen too fast because you're not going to have enough calories to build that muscle very fast. And insulin is needed to grow the muscle as well. So as a result, you have to be careful about, that's why a lot of guys, they go to the gym and they get bulky. Well, they have a lot of fat. They don't have definition. They have these big muscles, but they don't have a definition. They're not ripped, right? So those guys who look ripped and they have well definition are the ones who are really watching their carbs because they know that excessive carbs will make them fat, even if they go to the gym and work out.
You quickly mentioned fructose there, and I think it's important we get into this because not all sugar is created equally. So let's talk from a metabolic perspective. When somebody is taking in fructose, how that is, in my mind at least, a worse sugar than glucose.
Well, the fructose is not created, not every fructose is created equally, right? So when we say fructose, it comes from vegetables and fruits, and also it comes from high fructose corn syrup, right? So our body is designed to handle fructose perfectly fine if it is coming from fruits and vegetables, unless it is excessive. I have patients who will say, "Oh, I eat a big bowl of fruit 3 times a day." I'm like, "Why? Like, why do you eat that?" Because anything excessive will cost you. But our body is designed to handle natural fructose perfectly fine. The problem happens when you overload the system, when you start eating candy, sodas, ice cream, all that stuff that are high in man-made fructose, and liver will be overwhelmed, and that will create lipogenic enzymes, and it will create triglycerides, and that's going to create fatty liver, and then you're in trouble. And fructose doesn't have the rate limiting step that the glucose has. So any glucose that comes in, it's going to turn into fat, or it has to be turned to glucose and burned. Yeah, if you, like I said, if you take the fructose in, you burn it right away, okay, no problem. But most people don't do that, and it ends up accumulating in their liver, causing the fatty liver and insulin resistance.
Yeah, I'm glad you clarified there. I'm exactly on the same page. I'm talking about the man-made type of fructose in processed foods, in sodas, and when it comes to fruit, obviously moderation is key.
Exactly, exactly.
Let's talk about other things you'll talk to patients with when they come to you. We've talked a lot about the diet piece. We've gotten into exercise. What are some of the other factors that you talk to patients with when it comes to managing healthy blood glucose levels?
I guess I would say sleep is very important, because if you don't sleep well, you develop insulin resistance. And that's a huge problem, especially postmenopausal women or older men. They start losing their sleep. And that's because of lack of sleep hygiene. And a lot of people don't even know what a sleep hygiene means. But if you don't have a good sleep, don't expect good health. And that will destroy your insulin resistance. So that's, I think, one of the big things. And the second thing is light exposure, like what I'm getting currently, right? So light exposure, too much light exposure, especially in the evening, has been shown to increase insulin resistance. Um, and getting oxidation damage, like let's say being under the sun too much, even that can cause any type of damage that you do to your body, any type of inflammation. God forbid, you may develop ulcerative colitis, rheumatoid arthritis, lupus. Any inflammatory condition in your body will make you insulin resistant. So I always tell them, stay away from inflammation and inflammatory foods. Now, since we are excluding diet here, anything and everything that can cause significant chronic inflammation. Now, we're not talking about acute inflammation. Acute inflammation is actually good. Like you go exercise, you burn some muscles, your body fixes that, learns how to deal with it. But the chronic inflammation, like chronic lack of sleep, chronic, light exposure at night, going to bed too late, being on your computer all the time, things like that will cause insulin resistance. And even if you think you're doing everything right, you'll still pay the price.
How about chronic stress? How often do you see that being a problem with patients? And talk about the physiology of what happens in the system when that's out of control.
Yes. So exactly. I mean, so the thing with the stress, we recommend people meditation a lot, because the stress will increase cortisol. And a lot of times, stress is self induced. So the things that causes stress is because you think it is stressful. When you're a child, the same thing they'll tell you, hey, your house is under fire. They'll be like, oh, let's go watch, let's call the firemen, let's watch it. They don't care. So when you don't care as much, when you're more relaxed, you're not going to have the stress response, the cortisol response. But we do that to ourselves. And as a result, the cortisol is the perfect enemy for insulin. And if you can manage the stress, which most people claim that they cannot because they don't necessarily engage in the activities that can do that, but like relaxing activity, whatever you find relaxing, it can be, just the water may be relaxing for you, like doing water activities, taking a walk every day can be relaxing. But most of the time, people disregard these things. When I make a video on YouTube about these things, guess what? People don't watch it. I'm surprised. I'm like, hey, listen, these are important things. When I make a video about a food, everybody wants to watch it. But like to your point, it's not just the food. The stress, the sleep, all the other stressors that can physically or mentally stressing you will definitely increase the cortisol and adrenaline response, which will lead to insulin resistance directly.
We've talked a lot about blood glucose and spiking that and the insulin spiking as a result of that. Blood glucose aside, are there any specific foods that you find are really troublesome for diabetics?
So I think a lot of people use a lot of vegetable oils that are processed heavily. That's probably not the best way to, get your fats in. I always tell people, if you can afford, go for grass-fed animals. If you're eating butter, go for the grass-fed animal butter. Go for olive oil. So try to increase the amount of monounsaturated, polyunsaturated fats that are more natural. Like even with the olive oil, you want to go with the cold pressed olive oil that are least processed. And if you can achieve that, then you will be able to have all this anti-inflammatory natural food in your system. But when people go for anything and everything to just keep their blood sugar down, they'll go buy like processed meats, deli meats, just because it keeps their blood sugar down. But there's so much nitrates in there, there's so much salt in there that they are causing so much more damage and or cancer. So we know that deli meats are 100% associated with colon cancer. And we started seeing colon cancer in even 20, 30-year-old people. And we are questioning, why do we see this so many colon cancers? Well, because of all the processed meats. I have some patients who will say, "Oh, I go to McDonald's, I just eat their meat and I don't eat their bread." Well, yeah, your sugar will not spike, but how do you know that it's really helping you overall in your overall health? Same thing with the bacon. They'll just go eat bacon and sausage every morning, but again, that will cause damage down the road because of all the saturated fats that are coming from animals that have fatty acids. So when we think about saturated fat, by the way, we have to think about fatty acids. So not every fatty acid is the same thing. So we have to make sure that the fatty acid source is coming from an animal that has been fed right and treated right. And those fatty acids can be saturated, but can still be less inflammatory compared to other meats that are coming from animals that are fed not the right things. You are what you eat. The animals are the same way, and you consume those animals, and you inherit what they consumed.
So, in a general sense, quality matters. We want to be looking for the best quality we can find and afford.
Correct. Exactly.
For somebody who's tuned into this point and say they've been type 2 diabetic for quite a period of time now, and they've tried so many different things and so many different strategies to get their weight under control, and they just feel really defeated right now, and they've stumbled across this and they're feeling a little bit inspired, what would you say to them to keep them going and to give them that inertia to take that next step and not give up on their health?
I would say be your own doctor and advocate and monitor yourself and cherish your own success. Because if you are not realizing what benefit or what you're getting at the end of this process, you will not stick to it, right? So you have to realize what changes in your cholesterol or your blood pressure or your blood sugar is going to give you down the road, and give yourself a tap in the back and say, look, I have done a great job and I need to maintain this. And I think people are motivated with success. So success brings success. And they need to also find an environment and a group of friends who can actually motivate them. Because if you feel alone in this game, you will lose it, because there's so many the temptations out there that if nobody's helping you, if you don't have the right friends and right family members helping you, supporting you, and you don't have the right doctor who supports your efforts, um, then you will just feel like you're alone. And you need to understand that you're successful. You need to find people who appreciate your success. That will be your healthcare team. And you need to find friends who supports you to stay on track.
Well, I really appreciate everything you've shared today. This is a really in-depth, broad-reaching conversation. It's going to help a lot of people, inspire a lot of people. We're going to link up your YouTube channel below, link up your book, link up your social media, link up your website, everything. And I just want to thank you for coming on the show. This was great.
Thank you. Thank you. Thanks for having me.
Now that you're done my conversation with Dr. Ergin, you're going to want to stick around here and catch my chat with Dr. Jason Fung. There's a lot more to learn about fixing insulin resistance and reversing type 2 diabetes. I'll see you over there.
From a scientific mathematical standpoint, it's actually very, very obvious what needs to be done. You need to change.